Hello, I'm going to talk today about psychoanalysis and in particular about the scientific testing of psychoanalytic ideas. Very common to read in psychology textbooks. A lot of psychologists believe that there is no evidence for psychoanalytic ideas. What I'm going to suggest today is that there are problems with the evidence for psychoanalytic ideas, but it is an oversimplification to say there is no evidence. So, what type of evidence are we talking about? Well, it comes from different sources. The classic source of evidence for psychoanalytic ideas is a case study. Now, a case study is unrepresentative, it's a one-off case. It does not demonstrate ever that something is universal, that it's normal. However, a case study, properly documented by competent professionals, published in a peer-reviewed journal, is evidence that something exists, or can exist. And there's one I'd like to give a little mention. A very up-to-date case study from 2003. Peyton Gabbard published a case study of Mr. A. Mr. A suffered from adult baby syndrome. When he wasn't at work, he worked in American law enforcement. When he wasn't at work, he would dress in nappies, he would sleep in a cot, he would drink milk. There was also a sexual element to this baby-like behaviour. Now, this isn't a direct test of Freud's ideas, this isn't an experiment, but I would challenge you to try and explain the case of Mr. A from any other theoretical perspective. It's easy from Freud. We've got the idea of infant sexuality, we've got the idea of regression to an infantile state. It's quite easy to understand from a Freudian point of view, particularly when we bear in mind the life history of this chap. Now, if we can't explain it from any other theoretical point of view, and it's a real case study, well, it's not evidence that everyone has psychosexual development and Oedipus complex and so on, but it is evidence that they do exist. So, I'm going to leave you that slightly uncomfortable thought, and talk about some other sorts of evidence. Mark Soames, neurologist in London, did a lot of research on brain damage and what loss of different mental abilities following brain injury tells us about possible Freudian ideas. Well, one really interesting one is the association between dreaming and wishing. To Freud, dreams are representations of wishes. And we dream in order to satisfy wishes that we can't satisfy consciously. Well, what Soames has found is that patients who have lost abilities following brain injury dream more about those things. So people who are paralysed dream about dancing, they dream about sport. People who have lost speech abilities dream about giving public speeches. Now, that's much more in line with the Freudian view of dreams representing wishes than a kind of common sense view of dreaming about what's happened during the day. The final thing to talk about today, I'm going to say a little bit about psychoanalytic therapies. We often read that psychoanalytic therapies don't work or there's very little evidence for them. Well, there's a problem with the evidence. The type of evidence that you can get for psychoanalytic therapies is different to some of the others. CBT, for example, the most common type of therapy that psychologists practice, usually takes place 6 or 8 weeks. Very, very easy to produce evidence that it works. You're working with a single symptom or small set of symptoms the patient defines as wanting to change. There's a focus on those. You can have a control group who are on a waiting list. They have their therapy when the experimental group have finished theirs. So ethically there's no issue about giving some people therapy and some not. Now, under those circumstances, it's very easy to produce very straightforward evidence that CBT works. But now, think about this for psychoanalysis. You are very often dealing with very complex sets of symptoms, multiple conditions often, and patients with significant life history. Now, under those circumstances, it's very difficult to do the same kind of controlled study. The therapy might last a year, it might last 3 years, it might last 10 years. Now, under those circumstances, you can't have a matched control group standing by waiting for their therapy, because they have no idea when they'll get it. So for many reasons, psychoanalysis and psychoanalytic therapy are much harder to test. However, the kind of before and after comparisons that have happened, and the comparisons where patients can be allocated to a different treatment or psychoanalysis, are very supportive. They do show pretty much universally that psychoanalysis and psychoanalytic therapies are an effective treatment for a range of mental health problems. Okay, that's all for today. Thank you very much.